If managing a patient experiencing autonomic dysreflexia is concerning to you, this video will explain causes, signs and symptoms, and treatment options so that you are confident and competent to provide care. After viewing the PowerPoint presentation on autonomic dysreflexia, the staff nurse will be able to state 2 out of 3 causes of autonomic dysreflexia, identify 4 signs or symptoms of autonomic dysreflexia, explain 3 appropriate treatment interventions for a patient experiencing autonomic dysreflexia, and create a nursing care plan consisting of at least 3 interventions to prevent autonomic dysreflexia. Upon completion of this educational session, the staff nurse will be able to effectively manage care for a patient experiencing autonomic dysreflexia, adequately educate patients and caregivers regarding autonomic dysreflexia management and prevention, and incorporate patient care strategies that will prevent dysreflexic episodes. Autonomic dysreflexia occurs in individuals who have sustained a spinal cord injury at the level of T6 or above. It occurs due to the interruption in supraspinal control of the sympathetic preganglionic neurons following damage to the spinal cord. This lack of supraspinal control allows the sympathetic neurons to be hyperactive when a painful stimulus occurs below the level of injury, which results in dangerously high blood pressure. The signs and symptoms of autonomic dysreflexia exhibited by a patient could include a pounding headache, sweating above the level of injury, flushing of the face, neck, and chest, bradycardia, and most importantly, elevated blood pressure. Autonomic dysreflexia is caused by a painful stimulus below the level of the spinal cord injury. The number 1 leading cause of autonomic dysreflexia is bladder distension. The second leading cause is bowel distension, and the third leading cause is some type of irritation to the skin, such as an ingrown toenail. The care plan for treatment of a dysreflexic episode includes sitting the patient upright, loosening any tight clothing, draining the bladder, ensuring the bowel is empty, and assessing the skin to identify any irritating issues. If the painful stimulus is identified and removed, the dysreflexia will resolve and blood pressure will return to normal. If no cause is identified, notify the physician in order to obtain medication to lower the blood pressure until the underlying cause can be identified and resolved. Strategies to prevent autonomic dysreflexia include maintaining a healthy bladder and bowel management program to avoid overdistension, as well as maintaining skin integrity by teaching the importance of skin checks and proper padding and positioning. If you would like more information regarding the management of patients experiencing autonomic dysreflexia, please contact a nurse educator or see information posted on the staff education database.